I've been in healthcare delivery for 25 years now, and first built Wokhart hospitals right from their first venture, which was in Bangalore, and all the way through the 19 hospitals that Wokhart set up. Spent 19 years with Wokhart, setting up their various hospitals across the country. Post that, had Wokhart, 10 hospitals of Wokhart got acquired by Fortis Healthcare. So I went on to join Fortis Healthcare as their group CEO, worked across 12 countries to help set up Fortis Healthcare International. Then last year, in 2013, I decided that it was time to do something different, and that what I wanted to do in the next phase of my life was to look at a very new and disruptive healthcare delivery model. And that's how I incubated Medwell Ventures along with a very dear friend of mine, Dr. Farzan Engineer, who was the erstwhile CEO of Quintiles. So both of us started Medwell Ventures, and one of the entire theme of Medwell Ventures is in the out-of-hospital care. And the first one that we have done and incubated in Medwell Ventures and are currently scaling across the country is Nightingales, which is the home health company. And that is basically driving chronic care management at home. We are in home health with a very strong influence on chronic diseases. So we don't do too much of transactional stuff. So we don't do send me a doctor, send me a nurse, send me a physiotherapist. We are a care plan company. So we sell care plans for chronic diseases, which has a multidisciplinary team. So that team is physiotherapist, doctor, nurse, respiratory therapist, all the talent put together, which goes and then looks after the patient at home with a super specialist who has put together the care plan for the patient. Basically, the thought about home health started in my mind. I have elderly parents, and they live in Delhi. And my dad has got chronic conditions. He's got diabetes, and he has to manage it and all that. And it comes with age, and he's hale and hearty, but he has to manage some of his conditions like diabetes, hypertension, and some of the others. And then one fine day, both of us were having a conversation, and he said, "You've been running hospitals. Why do we need to go to hospitals for everything?" This is my father, right? And then he said that you don't realize that for some of the elderly parents or patients, it becomes so difficult to keep going back to hospital every now and then.
Actually, it was his idea.
So that was the spark. That was the spark. And I said, but, so what do you think needs to be done? So he said, do something about this. You build hospitals. Do you necessarily need to just keep on building more and more hospitals? And that is how this whole thing started. Because of my past background in healthcare and because of all the stuff that I had done, when I first thought about this idea of home healthcare, there was a lot of interest by the team to do it. So when Farzan and I first spoke about the entire concept, so when I say team, we actually created a startup team. So both of us, we got some of our colleagues on board, and we from Wokhart, some from Fortis. He got a couple of people from Quintiles. So some of and we sat together in Bangalore. We decided. So the idea was there. Then we went and refined the idea. We raised HNI money. We raised about $2.5 million of HNI money, which got signed up in 2 days' time. So we didn't really have to really go out there and struggle too much about raising our first round or the seed round. We got that, and within 6 months we actually did our we did our Series A. So we currently now do about 200 home visits a day.
And how much you're planning?
So in the next year we should be probably, by the end of this year, we should be probably doing about 500 to 600 home visits a day. Because in terms of the number of cities, we will just grow exponentially.